Please pause and read the objectives. I won't read them each to you, but these are the objectives that we are going to cover, as well as the continuing ones on this slide. Please have your book available for chapter 26. Now let's ask ourselves, what is therapeutic communication? So when you look at it, look at these bullet points, but make sure that we see here, we're helping relationships rather than a social relationship. Okay, so let's make the difference. Sometimes some folks cannot separate the difference and want to continue the relationship outside of the care and try to make it more of a personal relationship. So we have to make sure that we separate each and understand that our job is a caring relationship, a helping relationship, and not a social or personal relationship. As I scroll through some key terms, the page numbers are right next to them, but I wanted to show these key terms regarding relationships and things that happen with communication, attentive listening, boundaries. You guys see all of that? Most importantly, we want to make sure we have therapeutic relationships, therapeutic communications. Before we go too far, let's look at a definition or the introduction in your chapter, and still in chapter 26. And let's look at communication. Look at this paragraph and see what it says. Communication is a critical skill for nursing. Keep going and reading. Look what, and to express caring and comfort. What else is communication? So it is a dynamic process used to gather assessment data, to teach, and to persuade, and to express caring and comfort. So look at yourself and look at others, and what are some examples that you can give regarding this one statement? I wanted to add there's various means of communication, nonverbal, verbal, through dance, through art, is exchange of words. But for this context, for this class, communication is what we're going to focus on, and it is, excuse me, any means of exchanging information or feelings between two or more people. It is a basic component of human relationships, including nursing. Review this slide as I discussed to you a little bit more about communication. Now, there are different and various factors that influence communication. Please turn to page 416. With communication, we also have to look at patients with special needs. Now, what about the ones who have difficulty hearing? They face patients so they can lip read. So what you do, if you know someone is hard of hearing on one side or the other, you make sure you don't stand on that side. You stand on the other side, or you face the patient directly so they can read your lips. Or you can also take a piece of paper and write what you need on a sheet of paper so the patient can read it. And the patients who are having difficulty seeing, you can use the power of touch, or you can say things like, you can use a plate or a clock. Imagine a clock. Your food is at 12 o'clock. Your water is at 3 o'clock. Your cake is at 6 o'clock. And your rice is at 9 o'clock. So basically, you can use things like that to help the patient who's having difficulty seeing. Okay? Patients who are mute or unable to speak or speak coherently, we do have interpreter services who can come by and assist us. We have the language line. They also have video recorders that come on and that can sign language as well. So also cognitive impaired patients, most of them have either a loved one, family member, or caretaker. Patients who are unresponsive, the use of painful stimuli Sometimes you can see if they can respond knowing that they can possibly still hear you. But regardless if they're unresponsive or not, you still continue to talk to the patient. And like I said, language line for an interpreter of any language. As you go to page 419, box 26-1, I'm going to scroll through this slide, but I want you to pay attention to the bold letters over to the left and see what they stand for. So S, face the other person squarely. O, adopt an open posture. L, lean toward the person. E, maintain good eye contact. R, try to relatively relax or natural. Try to be relatively relaxed or natural. Okay, these are 5 guidelines needed that you need to adapt to specific needs of clients in a given situation. Now this is on page 420, but pay close attention. Using silence. Using silence. Accepting pause or silences that may extend to several seconds or minutes without interjecting any verbal response. That's when you, here's an example over here, sit quietly or walking with the client and waiting attentively until the client is able to put thoughts and feelings together. Okay? Also, providing general leads. Here is a statement for it, and also here is an example. Using silence is very important. As we can see, we may not have the words to say, or the patient might need time to think. Sometimes they just want someone there to listen. But listen, look at this table. Providing general leads, being specific and attentive, using open-ended statements. I'd like to hear more about that. Tell me more. How have you been feeling lately? What brought you? Don't go into the why or you should. No. Okay? You want to have that caring, soft voice and ask questions as such. Open-ended questions. The power of touch. Put an arm over the client's shoulder. Place your hand over the client's hands. These are all considered the power of touch. Restating or paraphrasing. So, sir, what I heard you say. Or, I couldn't manage to eat any dinner last night, not even dessert. The nurse. So, she's going to paraphrase. So, you had difficulty eating yesterday? Client, yes, I was very upset after my family left. You see how she just, oh, I think I screwed up. I'm sorry. You see how they just paraphrased it. Okay, restating. And here are some more. So check this box out. I know it's scrolling through fast, but you can also pause this and go back. So it ends on page 420. Let's look at this, and what do you think your answer would be? If you chose C, you are correct. Look at what the studies have shown. With communication comes education. Let's look at these bullet points about this. Educate patients about the safe and effective use of medications. We're educating. Remember, I'll always say educate, educate, and educate. And look at how the examples are to educate. Okay, why educate the patient why they're here, about their medication, about their environment, about what you're going to do, what's going to happen after your intervention. Keeping the patient informed through communication and education. Look at these factors and how they can impact the patient's learning. Individual learning style, developmental level, literacy. We need to make sure that we have the writing at the right grade level. I said that earlier in lecture, I believe it was last week, that grade level, age 10. Psychosocial adaptation to illnesses, maybe even in health beliefs. So we have to look at all of these and make sure that we are being open and patient-centered care for the patient. So making sure we understand them as a whole. Let's take a quick look at our domains of learning. You have cognitive, affective, and psychomotor. Look at the example for psychomotor. Look at the example for affective. Expressions of feelings and acceptance of attitudes, opinions, or values. And cognitive for sure is all intellectual behaviors and requires thinking. So when we're teaching our patients, keep these bullet points in mind. If it wasn't documented, it was never. As you read these bullet points, make sure you give yourself credit for everything that you do. If you gave the patient materials, educational materials, just don't give it to them. You give it to them, explain to them, make sure they understand the material, and you document that you gave the patient a material. Otherwise, someone will say, oh, they just sent the patient home any kind of way, no education, no this. And you go, no, I did. But if you didn't document the education, you didn't do it. Look how we define culture. It's defined as thoughts, communications, actions, customs. Keep on reading. Have you seen how your culture varies from someone else's culture? And just think about how the communication part or piece varies. Now take that and place the patient in the hospital and two different cultures and making sure that we attend to all their needs, especially communication. So culture is a concept that applies to a group of people who share values and ways of thinking and acting. Look at this slide. And remember, when we are admitting a patient to the hospital and we're doing the admission intake, we are also including a cultural assessment. That cultural assessment will allow us to be more familiar with the patient and understand their values, their beliefs, and their practices so we can attend to those towards their practice, meaning could be as small as what they eat, their environment, how to speak to an individual. All of these are part of the cultural assessment from the nurse. And let's not forget about the spiritual assessment. As you read the bullet points, everyone is entitled to have someone, whatever they believe in. We can't put our beliefs on a patient. So if they believe in something else, that's what they believe in. We can't say, oh no, that's not the belief that you should have. We should respect them and provide them with whatever cultural belief that they have and try to get someone in the hospital, provided if they want them there, to help them in their healing process. As we come to an end, I want you guys to look at Chapter 26 review. Here are some chapter highlights, and I also highlighted some things I thought was important. Well, it's all important, but make sure that you understand communication is a two-way interpersonal process involving the sender of the message and the receiver. So we have to make sure we send that message out positively so the receiver can receive it positively, not the opposite. Communication process includes 4 elements. Remember, the sender, of course, how the message is being sent, the receiver, and the response or feedback. Okay? Also, I highlighted, as we keep going, the clock is going against me, verbal communication. Look at all the ones that I highlighted. And look at the communication. Even emailing is on there. Okay? Caps, we know we don't do that anymore. That's considered yelling. Techniques that inhibit communication. Help clients with communication problems. Effective communication. Here you go. And that will be it, because we're going to end up going into 15 minutes and I will have to record all over again. Thank you.